Hello, this is Professor David Bishai from Johns Hopkins, and today I'll be interviewing Dr. George Alleyne, who's an adjunct professor at Johns Hopkins. Dr. Alleyne was the director of the Pan American Health Organization from 1995 and 2003, and I wanted him to describe for us one of the initiatives at that time. And he will describe for us the work he did on a book called Public Health in the Americas. This is a book that came out during the middle of his term. And I'd like to ask you, Dr. Alleyne, could you describe the events leading up to the initiative to measure essential public health functions in the Pan American region?
Mm-hmm. Well, thank you very much, David. You take me back now in history. In my first term, first of all, I was in PAHO from 1981. So I moved through various places in PAHO. I was head of health programs in PAHO, then assistant director before I became director. And about that time, in the early 90s, a lot of ferment, a lot of discussion of what public health really meant. And my predecessor had mobilized lots of thinkers in the Americas about how could you renew public health. A lot of discussion about the renewal of public health in the Americas. And when I became director, my concern was not so much with the renewal of public health. My concern was with how could you measure what public health was actually doing. How could you say to countries on an objective basis, if you did A, B, C, D, your public health would improve? That was my major focus. So when I was re-elected as director in 1998, it was, I remember very well on the day I was re-elected saying to, actually was the president of the Inter-American Development Bank, that I had three big challenges I would like to address. And one was in creating health for the Americas, a health agenda for the Americas. Something for, there was a long tradition of Pan-Americanism. This is also one of my major interests. There was a long agenda, a long history of that the American countries working together to do things. And PAHO had just been in the forefront of the elimination of poliomyelitis, and we were well into the elimination of measles, which parenthetically this year has been announced that the region of the Americas is free of measles. But what was concerning me was that there were no metrics for establishing what public health was really doing. So I decided then that we would launch an initiative, Public Health in the Americas, and the crux of that initiative would be some getting together with the countries to determine what 8 or 10, 12 things we should say should be done in public health in the Americas. That's the genesis of it. I was lucky then to have a really amazing colleague, Daniel Lopez Acuna, very, very, very bright was Daniel Lopez Acuna. And Daniel really spearheaded this initiative. This initiative involved most of the countries of the Americas and a wide range of health professionals in the Americas. Persons who had interests in biostatistics, epidemiology, health systems, health information systems, a wide range of health persons. And out of that discussion over 3-4 years really, and many meetings in all of the countries, we came up with what were the actually 11 public health functions. And this book, Public Health in the Americas, describes some of the origin of public health, some of the triumphs of public health in the Americas. I say triumphs deliberately because the Americas had a Pan American Health Organization has supported the countries of the Americas in many of the advances in public health. And out of that, it distilled 11 essential public health functions. Now, what things would we do differently? An initiative like this, for it to have legs and continue, needs continuity of, it needs to be tendered. It needs to be tendered over long periods of time. I sat down as director in 2003, and thereafter Daniel Lopez Acuna went to work in Geneva. So I think there was a lull in the interest and enthusiasm for this particular approach. So one recommendation I would make is for this to continue to be effective, there has to be continuity of interest. There has to be someone has to tender a young plant, as it were. So I'm actually so pleased, David, that you have seen and undertaken this tendering of this plant, because I continue to believe that unless there is some idea that you can give to countries that these are the essential functions that public health should perform, then we'll get all vague discussion about, is the public health functioning, is it not functioning? So that's one thing I would suggest, that it needs continued tendering, this whole initiative. So I'm very pleased that you have taken it on, and I should hope that your conference allows there to be continuity, not over time, but continuity in terms of the numbers of countries to be involved. That's one thing. What impact has it had? It's very difficult to tell, because I'm no longer director of PAHO, so I really don't know the extent to which it has some impact. I do know that in another region of the world, the Emerald Eastern Mediterranean region, they have agreed that there should be such things as essential public health functions, and they've launched their own initiative. They now say that I think it's 8 or 10 essential functions. We originally suggested 11. So that is a kind of spread we would like to see. We would like to see other regions of the world, we would like to see WHO as a whole undertake to embrace this as something that is central to strengthening public health in the Americas. One of the things of which we are quite pleased, in an obverse way, and pleased that much of the enthusiasm now for dealing with epidemics, preparing for pandemics, is understanding that the preparation for pandemics and the dealing with pandemics really depends on public health discharging these particular functions. So in an obverse way, we are pleased that these things are come to the fore. They may not be cast in the mold of essential public health functions, but I think the people are realizing that is absolutely essential if you're going to deal with the problems of the future. We are also very pleased to see the World Bank, Marion Payson, take this on as well, and appreciating that major funding institutions like the World Bank should, if they're going to be involved in health in the countries of the world as a whole, they should be involved in this. But there's one final comment I would make. While traditionally people have thought of these functions as being applicable predominantly to the communicable diseases, this is not true. Obviously not true. The world as a whole is having to come to grips with the non-communicable diseases, the chronic diseases. And what is absolutely clear to me, that this approach of looking at the functions that public health should discharge is equally applicable to the non-communicable diseases. So given the interest in non-communicable diseases now, given the interest at the political level and at the practical level in non-communicable diseases, I think that throughout the world one would like to see that this approach to determining whether public health in the countries can deal with the new problems. I think it is good to see renewed interest in this. And finally, I mentioned the interest on the non-communicable diseases. On the communicable diseases, this is important. I mentioned the interest in the non-communicable diseases, but there's a third great threat, I would say, to health in general, the issue of the antimicrobial resistance. And if one is going to address this issue, it is absolutely essential that public health systems discharge these functions.
Thank you very much.